Sorry for the troubleshootings. So welcome back, you all, for the constitutional. Before we going to constitutional approach of homeopathic treatment, we'll have a brief idea about the classification of diseases according to our master Hahnemann. Why the class understanding of classification of diseases is important is we should know how to apply, when to apply the short acting drugs and when to apply the polycrests, and how to deal with the each kind of underlying situations. To know the proper understanding of each diseases, and to treat and to select especially the drugs, we need to have the brief idea about the classification of diseases. So Master Hahnemann classified the diseases into the following mainly three categories. One is the indisposition, then surgical diseases, and dynamic diseases. Coming back to the indisposition. Indisposition means at large it is not a disease, it is a slight deviation of our vital force because of our the lifestyle errors, supposed to say overeating or a lack of sleep or over exertion of mind or body, all alcoholic abuse yielding to some of the symptoms like a nausea, vomiting, or pain in abdomen. uh, Such categories where the slight deviation of our health, uh, which can be set all right with or without medications, by just taking the proper diet, and by correcting the diet and having the proper rest. So just by maintaining the by avoiding the maintaining causes. What is maintaining cause basically is the factor which is responsible for the constant irritation, or the factor which is responsible for the disposition towards the disease is called as the maintaining cause. So by just removing that maintaining cause, for example, the lack of sleep, like on lack of sleep yielding to certain disorders. So on proper rest one can have, without medication one can get all right. Likewise, correcting the diet, and by avoiding the alcohol, tea, coffee, etc. So this way the indispositions are not truly a diseases. And next, coming to the surgical diseases. So here the surgical diseases, again, a few of the surgical diseases can be dealt with the homeopathic medicines itself. Example like tonsillitis, any renal calculi, or the mild polyps, or the warts, and all sorts of corns. This all can be treated by coming under the surgical cases, which can be treated by homeopathy, where we have a beautiful medicines which are called as the surgeon's knife itself. For example, silesia. The similar way, like even in after operation, where the sometimes all of us have come across like threads or any of the materials by the negligence of allopathic doctors, remaining in the abdomen itself, like so such things also, just by the giving drugs like Staphylococcus aureus or silesia, the uh, by making a abscess over that part, the abscess will burst out, and the underlying the heterogenic materials, or the neglected materials like threads and all, will come out naturally. So this is how we can deal the certain surgical diseases, except the congenital anomalies, like for example cleft lip, or congenitally having six fingers instead of five, or such way, like or wherever there is a large polyp over the head, Uh, these are the or uh, any tooth impairments like or to say the where the position of the tooth is either very prominent. In such cases, one needs to have undergo surgical corrections where we have limitations. So again, in a surgical diseases, we have all sorts of injuries also, road accidents or any injuries causing by overlifting, etc., where the injuries can be beautifully treated by homeopathic medications like Rastox, Ruta, Hypericum, Califas, Ladempol, all these drugs, where what is the need of studying the classification of disease prior going to constitutional drug is here. For example, in case of injuries or accidents, we do not need to see the mental constitution of the patient or whether he is hungry or whether he is thirstless, which thermal affinity he has, whether he's a hot patient or chilly patient. So how is the body built? So these all are it's not mandatory because here the surgical diseases, it's because of a sudden accident, the injuries may happen in any kind of a individual. So here, irrespective of the seeing the like here the constitutional approach is not needed, as it is not a disease. uh, so here, uh, uh, by having the like organ specific drugs or the short acting drugs, we can treat these injuries. For example, here in injuries, where if there is a superficial bruise, just arnica is sufficient. And if there is a injury deep down to the ligaments and cartilages, then along with the arnica, restox becomes necessary. Uh, and when the injury is related to periosteum means it is the covering layer of the bone, the superficial covering of a bone, we can say. So the injury deep down touching the periosteum layer, then the ruta becomes necessary. Likewise, in case of simple fractures, where we can call hairline fractures. This in a hairline fractures can be beautifully corrected by homeopathic drugs alone. The one of the magical remedy for the fractures is symphytum, except in a compound fracture. So in compound fracture, we need to have the help of a orthopedician to set in a position where the bones will alignment of the bones will be changed. Bones have to set back to the proper alignment, and then the application of symphytum, then it works in a beautiful manner. So this way, for a certain sort of a surgical diseases, we can use the homeopathic medicines wonderfully. Likewise, the one of the greatest medicine for surgical diseases is calendula again. Here, in all sorts of post-surgical cases, to heal the sutures in a very efficacious way without leaving scar marks and in a rapid way. Calendula works the best comparatively compared to all other the allopathic lotions like so here uh, we come across many of the surgeons and gynaes all are using the calendula in post-surgical cases. So next, coming to the dynamic diseases. Dynamic diseases are mainly classified into acute and chronic diseases. So, what are acute diseases? Uh, Acute diseases means these are the deviation. This is a deviation in vital force that where the symptoms onset of symptoms is sudden and progress is also sudden, uh, requiring the treatment on time. So acute diseases, they may the end may be like if the on time, if the proper treatment is given, uh, they'll recover. And sometimes if it is neglected, uh, we may lose the patient. So here acute diseases are more important. Acute diseases are again classified into three categories. One is individual, then sporadic, and individual can be taken as a endemic also. Uh, Endemic, sporadic, epidemic, and after epidemic, we can count one more as a pandemic. Here, individual is where the endemic. Here, N means it is a single, and demic means it is referring to the global area. Here, the certain type of diseases affecting the individual on individual base in a very small area, or the very specific areas. For example, goiter, which was prevalent in certain parts of the India. Likewise, malaria, which is more prevalent in African countries. Uh, so these are taken as a, endemic diseases, are the individual ones. And next is the sporadic. Sporadic means here again, uh, certain set of disorders were limited to very small areas here and there, uh, affecting the individuals where the symptoms differ. For example, diphtheria occurring somewhere in North Karnataka, again in the few areas of Maharashtra, like that. Measles, sorry, mumps, or these are the few examples. Next, coming to the epidemic. So here, epi means it is above, and demic means again it is the area which can refer to the little part of the globe. So here, epidemic means it is the set of symptoms which arise rapidly, and the progress is also rapid, uh, covering a large mass of a locality. For example, where the dengue, the recently we have gone through the large cases of dengue in the past 4 months in Karnataka, most of the cases from Bangalore, where uh, the these are the diseases affecting in a larger scale with a similar set of symptoms, and the underlying cause will be the same. That is, the underlying cause will be preferably the virus, uh, like a dengue virus. So next is a pandemic. So pandemic means it is a epidemic spreading to a larger extent. Here pan means it is a global level, or can say all. So demic means it is the globe. It is a pandemic means these are it's a disease which can be seen at a time with a rapid progress and with a similar symptoms, and with a rapid progress and onset seen in a large number of people, uh, involving the few of the countries, or sometimes the involving the group of continents also, or it can be in other broad spectrum, can be said as a worldwide diseases. For example, the COVID-19. So this it comes under the Like epidemic in a large scale, when we take it as a pandemic also, we can consider it. So here, so then what is the need of understanding these classifications? How it is going to help us in treating homeopathically, vibronically is. So here in endemic, according to the group of individual symptoms, will derive the drug. Whereas in epidemic, there we call it as a genus epidemicus. Uh, Genus epidemicus means here one of the drug from among the polycrest, like so what is polycrest drugs here? Poly means many, crest means it is a crown. These are the drugs. Polycrest drugs are the one which cover the larger set of symptoms. uh, so it will cover the certain all the kinds of constipations, but also at the same time it will cover all sorts of diarrheas. uh, Similar way, like it will cover the such drugs are called as the polycrest drugs. Uh, Here specifically in epidemic or pandemic, by studying the polycrest drugs deeply and by filtering the symptoms, the majority of the symptoms we are seeing in the uh, group of the people. Uh, by considering those symptoms, we derive one drug which covers the most of the symptoms of that epidemic disease. That is called as the genus epidemic drug. So that drug is applied as a preventive as well the curative to the entire mass. So this way, the classification helps us in dealing with the drugs. So next coming to the dynamic diseases. This dynamic diseases again classified into acute and chronic diseases. Sorry, the in dynamic already we have taken completed the acute diseases. Coming to chronic diseases. So here the chronic diseases again are divided into diseases with the partly developed symptoms and diseases with fully developed symptoms. So here, this is not so important for the studies. Like here, the diseases with the disease full with the fully developed symptoms means where we can treat as per the miasms in a proper way. Where the in case of diseases with a few developed symptoms, again we have a classifications like a one-sided disease and uh, local melodies. And these are not so important. Just we study it briefly. So here the one-sided diseases means uh, these the certain diseases will be having only mental symptoms. For example, like a schizophrenia or depression, anxiety, neurosis. Whereas certain other diseases where the preliminary we need the drugs vastly covering the mental symptoms there. Whereas the diseases with only physical symptoms. So often we come across the patients like to say diabetic cases or any hypertensive cases or any other so-called the modern diseases, uh, where patient will be saying only their blood reports will be indicating they have the disease. The rest all will be fine in a very silent manner. In a they will be saying I am all right, mentally I am all right. Only physical symptoms will be there again specifically very few, and in other few like we will not be having any physical symptoms also. So only with the proper aid of the this laboratory checkups and all, we'll come to know the depth of the diseases here, and uh, There again, by selecting here the organ specific drugs. So how this classification help us here is, so where the only with the physical symptoms, or may not be with the physical symptoms also few of the times, uh, remaining silent, or maybe presenting with a very few symptoms. So here the, by going for the laboratory detailed studies, will come to know whether he is diabetic, and if is what is the sugar level, and what kind of medicine he requires at that stage. Uh, so next is local melodies. In the local melodies, again, it's classified as surgical and non-surgical. Uh, Here, surgical means, for example, large size of polyps seen in anywhere across the body, where or any large warts, or any other surgical conditions where it sometimes can be malignant. Uh, these comes under the with a very few symptoms. These comes under the surgical symptoms. Again, local maladies. Local means here it is affecting to the only the single locality. For example, gout. Gout affecting the greater to very often when we take the classical gout. Sometimes around 60 to 70% of the people suffering from gout, it is the symptoms are limited to only large two, whereas in 20 to 30% other, it may involve other joints also. So in gout can be considered as a local malady, uh, coming under the non-surgical, where the gout yields by just correcting their uric acid levels. What is gout? Gout is the excess of uric acid leading to joint pain, specifically the grade 2. So here, by selecting the organ-specific drugs like benzoic acid, uh, it can be beautifully dealt. So next, coming to the in chronic diseases, non-miasmatic and miasmatic. So non-miasmatic means where the diseases have are acquired. It is not really from the deviation of the vital force on a long term. It is not of a hereditary also. Already in the last class, we have had the elaboration of the miasms, and what are those, how they comes, and how like hereditary we acquire. uh, it's not like all the diseases are miasmatic. So here the chronic disease classified into miasmatic and non-miasmatic. Non-miasmatic means again here, the non-miasmatic again classified into three categories. uh, One is the diseases because of our bad hygiene. Uh, for example, here, sitting in a closed room where there is not proper aeration for a long term, uh, that's how developing asthma or some respiratory disorders, and overexertion of mind, uh, lack of sleep, uh, such things, uh, where the cause is it's again the improper lifestyle, it can be said. So just here, by correcting the maintaining cause, means which is making the disease to maintain. Here is, here the one developing respiratory symptoms, or over a period of years, COPD, that is a chronic obstructive pulmonary diseases, absolutely because of the lack of aeration, uh, because of not having the proper windows. So sitting in a closed room for years together. So so where the when the we remove the maintaining cause. So here, uh, why we need to study in a, again in a different classification here is like here diseases coming because of the bad hygiene, where we need to remove the maintaining cause. So without removing the maintaining cause, one only just by keeping just keep on giving the medicines, this will not be helpful. So unless and until the maintaining cause is there underlying, so unless and until as in respiratory disorders, so when by giving him proper aeration, asking him for proper walk and exercise, so that is how then applying the proper medication, then his disease can be uh, permanently gets healed. Otherwise, irrespective of the number of medicines recurrently with the on continuous treatment, also the patient will not be yielding, and again he'll be suffering. So second is the heterogenic disease. Heterogenic disease means it is these are also called the artificial diseases, whereof the most of the diseases are born because of the negligence, or because of the mainly allopathic hands, drug abuse, like continuous intake of harmful drugs, or steroids, or painkillers, uh, or repeated antibiotics. Which are not suitable to the individual. So by undergoing basically the diseases are responsible, where the allopathic medicines are responsible for such diseases are taken as the heterogenic diseases. So here again, so we need to it's not like just keep on giving them homeopathic medications. So it will not be helpful. Again, only supplementing our medicines again, asking them to come again and again, because until we remove the underlying allopathic drugs which is making him worse, till the time we stop the steroids or painkillers or certain drugs which is making him harmful, so unless we remove or we ask them to stop those allopathic medications and then giving the proper homeopathic treatment, there the patient will be permanently healed. So next is the occupational disease. So these are the diseases referred to the people exposing to industries, where to say the cotton industries or any chemical industries, where the chemical colors are involved, or the fabrics creating the respiratory disorders. Uh, so certain poisonous fumes, all this, the diseases arising because of the constant working in a certain the harmful industries, getting the health affected, or coal in a coal miners. So these all the comes into occupational disease. Again, here our role responsibility is, uh, along with the proper medication, we must guide the patient properly. We must educate him not to, stop that kind of the working this thing, and to have a fresh air, have a regular exercise, and changing his occupation, by changing in certain diet and proper exercise at the same time, and by changing occupation, shifting to the natural, where the he hasn't exposed to the harmful fumes and all. By selecting the other occupation, he can permanently get eradicated by his disease. So next, coming to the miasmatic diseases. So here, so in the last class, we have went in a elaborative session where the miasms, we know, first is the, it is the desire for unwanted things. Just we will go for the brief this we'll go briefly for again the three miasms before entering into the proper constitutional drugs. So here, what is the how the disease occurs as per our master Hahnemann is, it is the excessive desire for unwanted things. So desire must be there, uh, but that should not be the for the unwanted things. The excessive desire for unwanted things that leads to a disease that he classifies into basically the sora, where the after the excessive sin, where the Noah's flood happens. So in the Noah's flood, 70 to 80% of the population will be vanished, and the in the remaining 10 to 20% of the population, where with the less sin commitment, in such people, they remain with the mainly the skin disorders in the form of itch, that is called as a sora. Here the sora becomes the mother for all the diseases. uh, so everyone will be having the underlying sora. So irrespective, here the king of the sora is sulfur, the sulfur and sorinum. So sulfur drug is useful in everyone. So as all of us are, none are sparing from sora. Yes, it is. We say it is a mother for all the disease. So, whenever we are unable to select our drug, or it is whenever we come with a very small set of symptoms, just we read like a one-sided diseases, or diseases with a partial symptoms, or diseases with a one-sided symptoms where there is only physical symptom, or there is only mental symptom, or where the laboratory testings are showing the abnormalities, uh, whereas the patient will be saying, I am all right, will not be exposing any symptoms. So in such categories, again, why the understanding of for these miasms is very important is, so here, irrespective, like just by going to the drug sulfur, uh, so the suppressed symptoms will start erupting out. So here, in most of the patients, uh, we will be coming to know they will be having rheumatoid arthritis in a severe form. Uh, Still, like on a certain climate, there is will be sudden outburst, whereas sometimes the symptoms become silent. Uh, that is because of mainly the suppression by either the allopathic drugs, mainly because we can say the allopathic drugs, and sometimes because of our the oversensitive, the some or mental symptoms also, like too much of mental exertion sometimes suppress the menses, and suppressing the natural cycles. So that way also, so whenever where there is, we have a very few symptoms and we are unable to approach for the proper drug, so blindly we can go for the sulfur, sulfur once in 15 days, uh, and then next coming once in 15 days for 2 to 3 times, then followed by once in month for another 2 3 times. So that way slowly his suppressed symptoms start coming outside. Uh, so then we will come to know the proper diagnosis, and then we will get the proper constitutional drugs again. So that is how, like, coming back to the miasms again. Here the miasms are divided into sora, that is the basic nature, where the symptoms are very superficial, like where all the soric symptoms can be reversed. Uh, and where next is the psychosis. Psychosis is the mid stage of all the diseases, we can say that. In other terms, coming to the pathological terms, sora can be said as the inflammatory stage or congestive stage, and psychosis is the middle stage of a consolidation or swelling or the tumors, where as we have taken with a basic concept, like for example, there is a redness of skin with a pain that comes under sora. So when we leave that without a medication, that there appears a small tumor, that is the psychosis. Then if we left untreated, then what happens is, after certain period, that the boil starts accumulating the pus, and then burst out, then turn into gangrene, necrosis. This fall into syphilis. Syphilis is the tertiary state, affecting the mainly bones and the destroying the different parts of our body, organs of our body. So that is how, like, these miasms are divided, basically miasms into two categories: simple and complex. In simple, there is a psora, syphilis, psora, psychosis, and syphilis. And then in complex, complex miasmatic diseases means, here it is not always like a person or a patient coming to us has the purely having the psoric symptoms. He may be in between psora and psychosis. He may be having few symptoms of psora and a few symptoms of psychosis, or sometimes, like, he may be having few symptoms of psychosis and a few syphilitic symptoms, where there is a, in some parts, there is a congestion, in some part there is a towards destruction. So in the mid stage, that is how, like, further he classified as a sora psychotic, where the few he is in between the sora and psychotic stage, and then sora and syphilitic. Sometimes what happens is, especially this psora syphilitic categories of patients, Master Allen gives us a tubercular miasm. That is a fourth miasm. Basically, Hahnemann has classified only three miasms: psora, syphilis, and psychosis, where in the later stage, Dr. Allen comes to know where the some of the time Sora, instead of entering into the second stage, psychotic stage, directly jumping to the end stage, that is directly the Sora jumping into syphilitic stage, from the inflammatory stage directly to the destructive stage. So such category, such miasm is considered as a tubercular miasm. Uh, and next is the psychosyphilitic. Few cases may come at the stage where they are in between. Few symptoms will be having psychosis, and another few symptoms are in a syphilitic. So such times there are a set of drugs which are predominantly psychosyphilitic, such categories of drugs to be used for the proper treatment. And then next, the last complex diseases: psoric, psychotic, and syphilitic. Psora psychosyphilitic is the condition where, similar again, a few symptoms will be psoric, few is psychotic, and few is syphilitic. So the merging of all these symptoms together in a complicated way, that is termed as a psora psychosyphilitic stage. So hope uh, I could clarify the classification. Still, it seems a bit complicated for the beginners. Just I'll request to go through the chart and just keep listening repeatedly. Any doubts will clear in some of the sessions. So, coming to the constitutional approach of diseases now. So, what is the constitutional drugs here? So, constitutional drugs can also be taken as a polycrest drugs. Here already we said poly means many, crest means it is the crown. These are the drugs which cover the majority of the symptoms. Few drugs, like calcarea carb, pulsatilla, graphitis, causticum, then arsenicum album, sulfur, phosphorus, restox. These all are the polycrest homeopathic drugs. I'll be sharing you uh, all the polycrest drugs shortly. So today, here I will focus on three female polycrest drugs. We will see how they resemble each other and in what way to differentiate each other. Uh, the three female constitutional, or to say the polycrest, both meaning is same. Constitutional means it is taking the person as a whole, right from his mental appearance and physical appearance to the soul level. To the soul level means here, certain times what happens is just by the gestures, where the patients will be unable to express in terms of words by their recurrent the gestures, like for example restless feet, shaking now and then, shaking now and then, these not coming up with any explanation, like where such expressions. So again, taking in a totality, like by considering their mental symptoms, physical symptoms, and the by taking the entire constitution right from the top of the head to the foot, like what all the organs are affected and what all the various symptoms they are representing with. So here how the homeopathy differs absolutely from allopathy, and where we say we have a permanent cure in homeopathy is it's only by considering the patient to the depth of his dreams, his thirst, his appetite. We discussed it in our last class. So, by considering them as a whole, for example, what happens in allopathic, like if 100 patients of a diabetic comes, so they'll be treating with the initially with the basic drugs as for metformin, gradually extending it to glycomet. They have a set of pattern, like so irrespective of the number of patients, there the application will be similar to all. Example, application of quinine in case of all the malaria cases, irrespective. Whereas in homeopathy, so if the 10 diabetic patient comes means, how we differentiate the 10 different drugs here is by seeing their how tall they are, how fair or they fair, or how their skin tone is, how their mentality is, what is the way they keep expressing, and what all the physical symptoms they have, and in what way they are getting ameliorated, means they are getting betterment, and in what time, including their time, which time the symptoms are more worse and which time the symptoms are better, and in which position the symptoms are more worse, uh, and the desire for what, and their aversion for what. So what kind of a dream pattern they have. So by considering the to the depth of each of the entity here, that by considering the depth, then applying the deep acting polycrest, to say the constitutional drug, that how that helps in taking the disease permanently from the root cause. Again, one thing here I need to focus is here how the chronic concept of chronic miasms or chronic diseases, how it is evolved is initially our master Hahnemann, he was dealing with the cases. He was not aware of chronic diseases or miasms as such. So he was dealing with the cases coming to him. He was giving the proper medication. The patients used to get better for some time. Again, after lapse or few months, or to say few years, again the patients would come with the same set of symptoms again. Uh, so again with the similar medicines, they are better, and again after sometimes they are coming again. So this recurrent nature of the arrival of the disease, that led him to the proper meditation again. So after meditation to the many more years again, so what is that entity that making again the disease to come repeatedly? So that made him to discover the miasms and the these deep acting drugs. So here for such diseases, here again the we call it as the intercurrent drugs also. The all the kings of these miasmatic drugs, like sulfur is the main drug of Sora, then Thuza is the main king for psychosis, whereas aurum syphilinum is the king for syphilis. Like, so here these are called as the intercurrent drugs also. So by applying these these drugs in between the our chosen polycrest drugs. For example, we are by taking the entire constitution, physical and mental appearance, we are selecting in a lady a calcarea carb drug. So, so at the same time, we need to like to make it permanently not to recur. In the middle we should keep giving her sulfur and the thuza drugs as an intercurrent drugs. So these intercurrent drugs will help the deeper suppressed symptoms to come out to the surface, and thus to eradicate the disease completely and permanently. So coming back to the constitutional female drugs, today we will start with the three important female constitution drugs. One is the calcarea carb, then graphitis and pulsatilla. So coming first to the calcarea carb. Just a minute. Slides will be displayed you later. So coming to the calcarea carb. So calcarea carb, these all the three drugs, the calcarea carb, pulsatilla, and graphitis, how they are similar and in what way they differ. When to select calcarea and when to select graphitis and pulsatilla will come in details. Uh, Basically, these three drugs are the most important female drugs of homeopathy. So these are mainly indicated in menstrual irregularities. Also, in many of, as we said, it is a constitutional drugs. Also, these are also called as the polycrests. Also, means polycrest means these are helpful for the many of the diseases, like in a just like a broad spectrum antibiotics. Here we can use in the majority of the diseased cases. So coming to the calcarea carb. So calcarea carb lady is a fair, flat, and fatty and flabby. She can be identified with the basically three Fs. That is fair, flabby, and fatty. Uh, and Calcarea carb lady is because of you can take her because of her obesity or even or because of the over sluggish nature of to the core level. There is a great aversion to mental and physical exertion and very sluggish in nature. Slightest mental exertion or physical exertion that leading to uh, diseases. Such females come under calcarea carb. Calcarea carb is prepared from the shells of the ocean. That is from calcium by deriving the calcium carbonate from the shells. She is fair, fatty, and flabby, sluggish in work, and there is a great aversion for physical and mental exertion. This calcarea carb is mainly said to be related to bone and the glands. Uh, Here, taking to the all the premature babies, where there is a large head and all the this large-headed baby or the babies born in seventh, eighth, ninth months. These all majority of the for these babies, calcarea carb is the best medicine, where the skull frontalis are not closed. I mean, in the proper time. There is a delayed milestone because of the lack of calcium or improper calcium metabolism. Basically, we can take it as a nutritional deficiencies, all sorts of nutritional deficiencies. So as it is like when we indicate these to the premature babies, so there itself we come to know because of the prematurity, here the nutrition will be obviously lacking. So further, these are the babies or the adults who are coming up with the largest nutritional deficiencies. Can be given calcarea carb where their metabolism gets corrected. Basically, the mesenteric glands. This mesenteric glands are the one they are seen at the attached at the sides of our gut walls, helping the absorption of the food properly. So here, in certain babies, we see irrespective they eat a large quantity of food, irrespective from the outsources are provided all sorts of nutritious foods. Still, the babies will be lacking from the nutritious point. Again and again, will requiring the uh, there's all sorts of vitamins and calciums all. So here, how beautiful the homeopathic approachment, the importance of homeopathy is. So, to what length one can keep supplementing, right? So, again and even after the supplement, again in a month or 2 months, again they'll be deficient, again they'll be deficient. So, in such cases, in a modern generation, also, especially off late, we are coming across, it's more than 90% of the population with the deficiency of vitamin D here. Again, here the cause is different. Obviously, we are not getting the pure sunlight because of the these all the ozone layer, the perforated, and so much of pollution, everything. So here the basic thing is, the patients coming with the even after a proper supplementation of vitamin D, again and again the vitamin D is becoming deficient, then you can choose the calcarea carb blindly just by giving a few doses of a calcarea carb. Calcarea carb, as such, it is a very deep acting drug. If one dose is given, it will be acting minimum for 2 months. So, by indicating the calcareal carb once in 2 months, around 2 to 3 times, once the mesenteric glands will be activated. So here what happens is the mesenteric glands will be very sluggish. Even though the external supplements are given, they are, because of the sluggishness of the gland, they fail to absorb it, the nutrient, and the nutrition given from the diet will be wasted. So just this calcare carb help influences in absorbing the nutrients properly. uh, and the next is the calcarea carb patients are very chilly in nature. They cannot tolerate cold in any form. Slightest the open air makes them aggravate, makes them catch cold, cough, or lacrimation, certain respiratory disorders. They are very sensitive to cold in any form. Always they will be covered. They are in a closed room. Uh, uh, they're very silent, mild, yielding, with a yielding disposition, gentle, and at the same time, they're highly intellectual. And just coming from the scalp, from the top portions, how the constitution exactly is. Generally, as we already said, the calcarea carb head will be generally larger, but it's not like. So when we come to the patients where the all the rest of the symptoms are of a calcarea carb, but the size of the head is normal, then just by seeing by giving importance to their head size, it's not like calcarea carb should not be chosen. The reason of studying the polycrest drug is like, when we see the more than 70% of the symptoms are seen, then the that drug can be easily given. So here they're very sensitive to cold atmosphere. On slightest exposure to open air, they get aggravation. And here in calcarea carb, certain polyps, like when we take from the right from the scalp, like what all the features are seen, where all the calcarea carb can be applied is here. When we take the scalp, the in children's, like open frontalis. Frontalis means the where the suturing part of our skull, here on the at the vertex part, and the frontal front, these are the frontalis occipital area, and the here the front where the we call it as a frontalis, where the sutures not get uh, I mean, they do not get united. They remain open even after the time period. That is because of the calcium impairment again. Uh, so for such child's calcarea is given. And in other cases, coming to the skull part, where the large polyps are there, or large sizes warts are there on the head, or I can say navies. Means there's navies means again there are blackish eruptions overhead. For those all, the calcarea carb is a beautiful drug. So not only on the scalp, this is the polyps and all sorts of warts. Polyps means these are just like a cherries, a tomato, like small cherries seen anywhere in the body. The most of the polyps are congenital only. Calcarea carb is a beautiful drug for the polyps. Uh, and then next coming to the eyes, and here next is the prior to the eyes is the brain, where like there is a vertigo. So here slightest ascending, uh, that ascending on the steps makes them giddy, or just turning the head makes them giddiness. So all sorts of vertigos, especially on uh, ascending the steps, and the slightest mental or physical exertion that yielding to giddiness. So such categories calcarea carb can be given. And sinusitis, the frontal headache or headache, especially causing from over weight lifting. Again, all the sorts of discomforts arising from uh, weightlifting or over mental exertion or physical exertion, whatever it may be, headache or any body pain, the calcare carb yields best. And the next is the eyes part. Eyes again here the lacrimation on a slightest exposure to cold, and there's a rawness in the eyes, burning, itching, and especially the lacrimal fistula. So fistula means it is a track formation from uh, yeah, or it can be said there is a in the form of a duct or a track in between attaching from one organ to another or one part to another. That is called the fistula. Uh, in all sorts of fistula, calcare carb is the main drug. So here again in the certain types of fistula seen in the eyes, calcare can be given. Again in the corneal ulcers, then oversensitivity for the light, especially for the long-sightedness. Calcarea is the wonderful remedy. Then coming to the nose, the great dryness of the nose, and on again the slightest exposure to cold atmosphere bringing or in cold application or any form cold intake in the form of drinks or maybe from the atmosphere or like or open windows, the slightest coldly items or cold things making worse like this frequent sneezings or acrid discharges, or it may be sometimes blind discharges, all kind of a nasal discharges and nasal polyps, and again the for the tonsillitis in the throat part, tonsils, calcare carb is the wonderful drug for a tonsillitis. And next coming to the this desires diversions, calcarea have the great desire for already we the common people will be knowing like who the persons lacking calcium will be more craving charcoal, pencil, chalks and all such things. So here as it is lacking of calcium, that making craving for these things. And so again in throat there is a it is greatly indicated for tonsillitis and also adenoids. It is one of the wonderful drug. So coming to the stomach, there is a great dyspepsia with a desire for this chalks and charcoals, all those things, and the flatulence, all sorts of stitching or colicky pain. Then coming to the female organs. So calcarea is as it is we said these are the main female drugs. So here the menstrual pattern is too early and the bleeding will be to the larger extent, the bleeding is profuse and a long lasting. So all the time menses will be appearing too early with a profuse bleeding and a long lasting. So patients will be fed up of bleeding most of the time uh, in their cycles. So those can be given calcare carb to saturate the cycles. And there is a increased sexual desire in a calcarea group. both it's not like it is a female drug, then it is not indicated in males. So all the female drugs are indicated for males also, but priorly they are more suited to female. So in the similar way, it is suited to male persons also with the excessive desire for sex and orchitis and stricture of at the scrotum. So for all with the frequent ejaculations, making debility. For such conditions, calcarea carb is a main drug. And coming to the skin pattern of calcarea, skin is very dirty or ugly looking, totally unhealthy, very often leading to boils or carbuncles. So, certain in a small group, we will be coming across every year or every once in 6 months, annually, or in a cyclical pattern, they will be getting boils. Uh, so, to completely eradicate these boils, uh, calcarea, when we give the calcarea carb, it will be taken permanently. They will be healed. They will not come up in future with the this recurrent boils or recurrent abscess of anywhere related to either breast or any part of the body. Such cases I have come across in a very large scale, where they have treated with the penicillin drugs or some cipro antibiotics, all the many other the related antibiotics, where they keep on suffering every yearly, and after when they are saturated and with so much of a drug complications, coming after a homeopathic treatment, they are permanently they are happy now. By the 10 years there is no recurrence. So now coming to the sleep and sleep. So here obviously they are oversensitive with the over exertion of mind and body. But on the even at the same time, the slightest exertion of a mind and body that leads to the disease. They are the calcarea group. The slightest mental exertion or slightest physical exertion. That is the reason they keeps all the time sluggish. They do not want to work. They do not want to take any task, even though they are intelligent. So here in the sleep also, because of the overcrowded thoughts, uh, their oversensitivity nature, that causes the sleeplessness. So by applying the calcarea, one will be all right. So this is all about calcarea carb drug. So next, we'll go for the another great female drug of homeopathy, that is the pulsatilla. And here we gone comparing calcarea with pulsatilla, how both they are similar and in what way they differ, and how easy to like when to indicate, when to like what way it will become easy for us to demonstrate these both of the drugs. Uh, so here the pulsatilla is basically both the calcarea and pulsatilla both are fair and fatty. But the difference is the calcarea carb patients are flabby. Flabby because of lack of the nutrition, mainly lack of calcium. But here in pulsatilla, there is only there is a frequent lack of iron. The remaining all the nutrients will be normal in pulsatilla ladies, and these pulsatilla ladies are not flabby as such. They're fair and fatty, and they can take the exertion. They are good at work in all kind of mental exertion and physical exertion. Even though the pulsatilla ladies are also the oversensitive, means they keep on means they are at the verge of either pleasure or pain. They are not an average ladies, like either they will be pain or they will be with the excessive pleasure. So such changeabilities are greatly seen in pulsatilla ladies, and they can take any task. They're courageous, unlike calcarea carb. Calcarea carb are very fearful. They cannot. They're not courageous. They cannot take any independent steps. They are very poor in taking the decisions. Whereas the pulsatilla ladies are the opposite of that. Completely opposite of this, even though they by the outlook they are same similar in appearance. They are fair and fatty and yielding, and here in pulsatilla there is a great weeping tendency. Without weeping, even the patients, while narrating their history, they start weeping. Without weeping, they cannot finish up their history. So, for such cases, blindly we can indicate the pulsatilla. They are highly yielding, intellectual, and then they are highly religious also. And at the same time, they are good at taking their own decisions and oversensitive, but again a little bit fearful towards evening. Both the drugs again similarities. Both are a little bit fearful toward, especially towards the evening and towards the night. Both are fearful here in when we take the entity for fearfulness. Calcarea carb fearfulness is because of the like they always feel like they are going to catch the contagious diseases. That is again one more reason they are hardly in public. They wants to be isolated all the time, because again both contributes here, their sluggish nature as well their the slightest exertion leading to the upsets, and at the same time fear of getting contagious disease. All the three of these features contributes calcare carb to be remained isolated, not to be very social. Whereas the pulsatilla ladies are very social, they can take any task. uh, a little bit they're inclined to religious matters, and here both the calcarea carb and pulsatilla ladies are chilly patients. But the major difference between these two is pulsatilla, even though they are chilly from inside, they wants to be in open air all the time. They wants all the windows to be opened, exactly the opposite of a calcarea, where they wants windows to be closed all the time. Here, the pulsatilla ladies, they wants windows to be open, doors to be open. The more the open air, the more they are better, even though there is a chilliness from inside in both the categories. And all the physical manifestations, or to say the physical complaints of a pulsatilla, will be uh, get better by cold application in all the forms, unlike the calcarea, where their calcarea carb groups are better by application of warmth. So here, so coming back to the fear section of both pulsatilla and calcarea is, pulsatilla ladies are more fearful towards the ghost, especially when they remain alone, especially towards the evening or night. They cannot stay alone because of the great fear and anxiety towards the ghost. Uh, Whereas the calcarea fear is getting contagious disease. So here, uh, coming to the matter of a taste, how they differ from each other is, there is always the calcarea patients more or less will be having a sour taste, whereas pulsatilla patients, in a majority of the pulsatilla patients will be saying either I am a tasteless, or there is a sort of a greasy taste all the time in mouth, that making me not to take food. Means that is the reason they do not want to have food properly, because of not getting the proper taste, the loss of taste, and at the same time loss of smell. That is one of the greatest feature of pulsatilla. Uh, so again, this pulsatilla, right from scalp to the bottom, like here, considering the this scalp and the head area, all sorts of sinus symptoms will be there all the time, and uh, the cold air also brings them recurrent sneezings and frontal headaches and deafness of the ear, and with the dryness of the ear, sometimes with the great stretching and digging sort of pains. And one of the characteristic feature of pulsatilla is the yellowish discharge. Here again, how the calcarea carb differs in calcarea carb, most often there is a watery discharge. Either it is a from the nose, or is it a leukorrhea also? Leukorrhea also, it is a transparent watery discharge. Whereas in pulsatilla, it is a thick, all the yellowish, whether it is a discharge from ear or the nasal discharges or the leukorrhea, it is very often it is a yellowish discharges, very thick and blind, with loss of smell, that is called ozena. Is Pulsatilla is one of the prominent drug for ozena, and a great dryness of the nose sometimes, and the or else sometimes dryness with a thick greenish yellowish scabs, uh, and whereas other times uh, thick yellowish discharges running together for months together, years together. uh, the same way in the throat also, like there is a itching and a burning of the throat, and mucus, whenever they hawk the mucus coming in a yellowish form. And the respiratory disorders again, on slightest weather change, they keep getting the cold, and it is one and mucus with all the respiratory symptoms will be with the thick, blind, yellowish discharges. Sometimes with a dry cough, sitting in the mid of the night, coughing continuously with a short of a breath. Whereas in calcarea carb, a short of the breathness is mainly by ascending stairs or physical exertion, unlike pulsatilla. Or in calcarea carb, by this cold items it causes. Whereas in pulsatilla, slightest change of any weather, from weather to weather, it causes this respiratory ailments. And coming to the digestive part, there's a great aversion to fats. So they do not, there's a aversion for fat, ghee, oily substances. Mentally also, they have the aversion to take this. They do not like this very much. As well, physically also, if they have taken forcibly, immediately they produce the dyspepsia in a larger extent, or else they have the great tendency towards the urticaria, skin rashes. So many patients we coming across on with the slightest changes in oil, or with the slightest ghee or butter, that makes me worse. My skin starts itching with a severe urticaria. Such all these comes mainly to pulsatilla group. And also the skin rashes are there on exposure to sun, in arterial rashes. So many of the cases will be seen. So where the only in the daytime on exposing the sun, they get the urticarias, and also or else maybe after fatty foods. So these the urticarias are greatly involved in the pulsatilla group. And the next coming for the like stools, here the no stools are alike in pulsatilla. This is one of the most characteristic feature of pulsatilla. Yes, very few of the patients coming across will be with the complaints of doctor. My stools are. It's not alike. I'm really I'm unable to describe. It's not normal at the same time. Either too much of diarrhea or too much of constipation. Overall, they are not normal. They will be suffering from one or the, or it will be totally undigested. Such extremes are taken in pulsatilla, where it is called like no two stools are alike. So again, the most characteristic feature of extremities, coming to extremities here. Here, the we have seen many patients where the hanging limbs makes them worse. They start severe pain in legs just by hanging down. They cannot hang the limbs to a larger extent, or to say, I mean, for a long duration. They have to take the limbs up, that making them great relief. These categories fall into pulsatilla. This is one of the characteristic feature of a pulsatilla. Uh, and all the another characteristic feature is as the also comparing the calcarea, how the pulsatilla differ is calcarea is mainly related to bones. So the where the calcium, the shortage causing the um, bony irregularities, all sorts of it, maybe calcaneal spur, or the open frontalis, or delayed milestones, or the even the rainbow legs we call in children, where the because of a lack of calcium, the uh, bones will be just like a bend like this, like a rainbow. uh, so immediately such kids to be corrected with the calcarea carb, and with the proper massage to the lower limbs at the same time, by correcting the limbs in a straight way. Otherwise, if they leave unrecognized, in future they remain for the lifetime with the rainbow legs, very soon landing into arthritis, all these symptoms. So it has to be corrected in childhood only. Here the calcarea carb is mainly related to the metabolism of bones, whereas pulsatilla is mainly related to veins. All the varicosities anywhere in the body. So here, for example, eyes, there is an engorgement of veins in the eyeballs, or the varicosities of the lower limbs, or varicosities seen in the scrotum. So anywhere where there is a venous engorgements, where there is a sluggish circulation in veins, uh, there to increase the circulation, this pulsatilla is one of the wonderful remedy. Uh, so likewise, the again the differentiating feature of calcarea and pulsatilla is uh, calcarea is more prone towards the glands, where all the glands will be inflamed, just like a tonsillitis, the adenoids, and submandibular enlargement of glands, or anywhere across the glands are where there is a great affinity for the glandular derangements and bony derangements. Whereas the pulsatilla has the derangement mainly with the veins. So here, coming to the sexual organs, reproductive part, in pulsatilla there is a delay in cycles. Charts. Pulsatilla.
Mm.
So here, coming to the this, just you can see in the charts also, like there is very much elaborative description. It's because of the short time, just I'm here guidelining the main features. So here, coming to the female part of the pulsatilla here, it's a great amenorrhea. Amenorrhea means it is delay in cycles because of the, it may be because of a nervous stability, or sometimes too much of sensitivity, just like it's mainly the wetting the feet constantly. So here the profession also important. Like if a lady not getting not menstruating properly all the time, there is a history of a delay in menstrual cycles. Then her nature of work to be uh, differentiated. It has to be elicited. Like mm, just by correcting the maintaining cause, like she has to be shifted from that work. So the constant getting of feet wet, or the over exertion of mind also, that makes the cycles a delay. How again here the female part differs from calcarea is, so in calcarea we have seen too early, profuse and long lasting, but it is a total opposite here. Too late, then tardy menses, and very scanty, thick, dark, and clotted. Whereas in Calcarea, it is just like a with a fresh blood. So one of the feature of Calcarea again is epistaxis and bleeding anywhere from the part of the body. Calcarea is given. Whereas here there is the opposite exactly. Here it is not bleeding; it is the engorgement of the veins, where the blood is congested. Here it's not bleeding. So the menses are always too late, tardy, then very scanty, thick, dark, and clotted, sometimes changeable. Uh, Here, one of the characteristic feature is all the discomforts of the pulsatilla are associated with the internal chilliness, and internal chilliness still there is a aversion to cover the body, unlike calcarea where all the time they covers up. And here coming again, the sleep part, respiratory already we covered. Then sleep, there is a wide awakes in the evening. Uh, First sleep is delayed all the time, and so that is the reason they never feel they are refreshed. And the habit is like they sleep with their hands on the head by keeping the even these positions greatly help us in discriminating the drugs. So similarly, for all the backaches, it can be given for lumbar spondylosis, and for in extremity pains where the pains aching or drawing pains because of the more worse on hanging the limbs. So here again coming to the fever part, the skin already we described, and coming to the skin part, uh, here the already it is description given as they are very prone to urticaria, especially from oily and fatty foods. The fever, how the fever of the calcarea carb and pulsatilla differ is, in calcarea carb there is a more affinity towards 2 p.m. Chilliness towards 2 p.m. Here, chilliness towards 4 p.m. So this is how in the fever aspect they differ from their time modalities. So overall modalities means it is the aggravating and ameliorating factor from what we feel better and one with what one gets worse. Like so, as already discussed, all the calcareas are better by covering by warm and they are worse by overexertion of mind and body, and they are worse towards evening and night. Similarly, the here the pulsatilla modalities are they are better by open air uh, and open windows, uh, open doors, and walking, and they're worse, and also they're better by cold applications, and they're worse towards the evening, and hot applications and lying on a painful side that makes them worse. So this is how we can compare and contrast these two wonderful female drugs. So I was about to deal with one more drug, but I think today it will be saturated, and it's again that may consume another 30 minutes. So better we'll deal it in a next session. So hope these drugs are clear to you. If any doubts, please let me. Any doubts, please?
Namaste, madam.
Namaste, namaste, sir. Yeah, please.
Uh, the nature of the females you described, can it be changed by environment, or it's by default static nature?
It is by default, sir. They are heredited in that fashion only. Uh,
Okay, ma'am. Okay.
yeah.
Thank you.
So, any other questions? This is what makes them unique.
Okay, okay. Got it.
Thank you. So hope today's session is clear for you all. So here along with the classification of the diseases, the charts will be all the three drugs charts are given. Please try to go through these drugs again in a detailed version. If any doubts, let me clarify in the next session. Thank you all.